accomplish. I want to accomplish as much as we possibly can in the period of time that we have. So in terms of a strategy, it's going to be important that we focus on what we think are the priority projects in here. We may not be able to accomplish all of these with the size group that we have. So that's going to be the main objective here, is what can we accomplish in the period of time that we have, and focus our efforts mainly on those top priority items. And I talked about a few of those the last time. Before we get into that, has everybody had a chance to take the survey yet that Andrea sent out in regards to the platform, the electronic platform we're going to be using?
No, nobody can access it. So I need to get on the rooftop and just use my megaphone and say I'm really sorry for the fourth time. Google is telling me, oh, everybody can access this, and that's obviously a lie. So I am it's 2 questions too, just 2. So I'm going to create a Survey Monkey and get that out this morning. And if anyone ever believes me again that the link actually works, then you can fill out the survey. So I'm sorry.
I thought you were just trying to prove the point about the need for an electronic platform that we can.
Yeah, exactly. I'm just trying to rub it in, right?
You have done very well. Okay. Anything else, Sandra, in terms of logistics that we need to chat about before we get into the topics?
No, I'm gonna drop the list of work plans into the chat so everybody can see them in print. So that'll hopefully help guide the discussion a little bit.
All right, so let me just give you the 60,000 view about what's going on other than just our particular issues. The BEA, the Business and Economic, Business Economic Affairs Department is looking for a project in particular. They're looking for that we can articulate to use ARPA funds for, and they want that relatively soon. I know that Jackie's been working on that, and Celicia have been working on that, and they're looking for that obviously statewide. That's going to have some impact. We've had several meetings since our meeting here with other people in the steering committee about how we might approach that and provide some input to Jackie in particular about what that might look like. So some of those discussions were, there's some software programs that will be very helpful to the childcare industry. Pro-Choice is one that was looked at by the folks in Coos County, as well as our own ECA group. I talked to Amy about that. Amy, you can certainly jump in anytime you want, but what I'm offering to ECEA is that I can have my cyber services department do all the security reviews. I call that direct support. There's no cost to the organization to do that, to make sure that they have their SOC reports and things like that. You may not be familiar with what those are, but they're security reports to make sure that the systems have the appropriate levels of security to protect people's personal identifying information. And also legal support to look at any contract that might be proposed. So we can do those sorts of things. And Amy provided 3 different software programs. And if that could be funded, we could provide that. Maybe we can get it like a 7-year contract, a 5-year contract, plus all of the setup to be able to do that. That could provide a relatively quick infusion of support to childcare entities if we could get that funded. That's a project that wouldn't take a whole lot of work in terms of a white paper, making the business case, the value of that to childcare providers. So that's one of the options that we're working on right now. I've also agreed to provide additional ARPA funds that the city has that could be used for the entire region. When I say the region, both Vermont and New Hampshire, to be able to make the case on to totally valueize the subsidy that's being provided right now, that's not being totally used, not 100% of it is not being used by the child care providers, and being able to apply for that and utilize that, then provide a discount on the backside of that. I've got a consultant lined up that can help work through that, and I'll also use the city's legal staff to review that to make sure there are no violations of federal law or state law when it comes to that, because there's arguments that some have made that that's price fixing and that sort of thing, and obviously we can't do that. So that those things are in the works right now. Jackie, do you want to talk a little bit more about the progress that's been made with the meetings? I've attended 2 of those meetings. I can't attend the 3rd. You just want to chat about that? Anything to that?
Absolutely. And did you just say you cannot attend the 3rd, Shaun?
Yeah, I'm gonna be on vacation. I was forced to
No
do.
worries. So if you just make sure you give us whatever you would have said, and we've already done a lot of that. Before I do that, may I ask a clarifying question? This is terrific that you're talking about using city ARPA dollars to help offset the subsidy. And I'm again new to this group. What's that subsidy that's not being used?
The subsidy right now, and Amy can talk more about it, she's more informed about it than I am, but the subsidy that's being provided to childcare providers for those in terms of their income ability, there's a way to maximize that. That's what she had talked about. I'm not the expert, she is. And that's not being maximized right now. So if that could be maximized, the childcare provider could get all of that support, and then they could provide a discount back to the consumer, that we can maximize all those funds. And that's not occurring right now. So how to do that properly, how to train and provide the guidance to childcare providers so that they can do that, and so they can be done appropriately too, and it's not an issue of price fixing.
Thank you, Shaun. And Amy, what is that subsidy Shaun's talking about?
She might
Are you
be.
there? I know her internet's a little unstable, it said in the chat.
Jackie, I think it's the child care subsidy. That's
The scholarship?
right. When programs don't fully utilize it, how can we help them better utilize and draw
for
down
their families
subsidy dollars, right?
Oh, terrific. Oh, I know what that is, Shaun. I'm sorry. I wasn't sure which. Okay, terrific.
Remember, you folks are the experts. I'm not. I'm just trying.
I just didn't know which subsidy.
Yeah.
Thank you.
So if we can figure out how to do that, we can create that model, then it can be used by everybody else in the state, obviously. So,
fabulous.
I've offered to fund the consultant that would do the work and use city legal staff to do that. That only helps our New Hampshire folks. It doesn't help the folks in Vermont because they have a different system that they use there.
Okay.
I'm sure there may be some parallels, but they can use whatever material, but it doesn't help. And for me, that's a big issue for me because half my people, my employees, they live in Vermont. So I have vested interest. And not only that, my employers in the city, a good portion of their employees live and work in Vermont. They live in Vermont. So that's critical to us. When you're in the southern part of the state, you can deal with just New Hampshire issues, but I have to deal with both. We have a vested interest.
Well, thank you. So real briefly, I know some of you have had the opportunity to be on these very, very quick process of getting a response back to Commissioner Taylor Caswell of the Department of Business and Economic Affairs in New Hampshire, who asked us, he wants to do something that helps both childcare businesses and other businesses, particularly help their businesses have access to and afford childcare, but also helping the childcare sector simultaneously. He asked us to go back to as fast as we could and come up with some recommendations for him for setting aside some Gopher dollars. And in New Hampshire, Gopher dollars, Gopher is Governor's Office for Economic Relief and Recovery, I think, and they have millions and millions of dollars right now that they are looking to allocate and spend. And so it could be as much as 25 to 50 million we're asking him to set aside for this effort. And that, here are the folks who are going to be working to put it all together. And here's the basic premise of what we want to have happen. So there have been 2 meetings that are both recorded. And then this Friday is our work session, not recorded officially, where we will roll up our sleeves and come up with a recommendation to give to Commissioner Caswell. And so be glad if you have not watched or been attending meeting 1 and meeting 2, that's all there's been. Now Friday's meeting 3, then we're going to give a recommendation to Taylor. That's how it works in New Hampshire. You basically, there's no real formal process for getting Gopher funds other than someone thinks it's a great idea and it can happen. So we want to seize that opportunity. So yeah.
All right.
Can I just tag on to that, this note, since we're on this track of thought here? I think that Brenda had a connection with somebody in Vermont who had experience in a couple different regions in Vermont. And if I'm not pulling up the details, just correct me, Brenda, but I don't know if that was some wisdom we wanted to talk about bringing into this group, since we're on that specific topic of partnering businesses with the childcare sector.
Yeah, so I do have some of those connections, absolutely, because we've been trying to build this for 20 years. In this group, we talk about like the sprint, and I feel like we're on a marathon over here. And so sometimes that's why we're sort of maybe at different places. And I'm happy to bring in some people who can speak to the experience, the expertise, and what's already happening here, and what's like sort of growing and developing even as we speak. But I want to make sure, thank you for that prompt. I also don't want to jump in when it's not the right time. And I want to make sure that I know when is the right time to bring those people to this meeting. And is it this meeting or is it subcommittees? I don't have clarity around that yet. And so, I had somebody lined up for I was like on hold for today. And then I was like, you know what, Jamie, I don't think we're there yet. She goes, that's okay. I know what it's like at the stand up, at the startup of something. So she's in the wings. She's one of the people who's in the wings. So when's the right time? Tell me, and I'll make the arrangement.
So right now, the idea of when we had a much larger group, because our numbers have dwindled, which is to be expected. So I'm not overly concerned by that. You come down to a smaller core of people. So my plan is that some of these are staff functions, and I'm going to have them work on the data pieces of that. And then we're going to synthesize the issues that we need to focus on here, the prioritization of that, and work on those. And that's what we're going to do in this group. It's not that large of a group, and it's actually manageable, I think. So I think we're in a pretty good spot here. So that's how I plan to proceed here. So just a couple.
So Shaun, if you can just give me real clarity about dates and times, and like, do we give her 15 minutes, 20 minutes, whatever, 5 minutes? Yeah, that I think is going to help me make the connection.
So I think the next meeting is when we want her to speak. And Andrea has to set those up because we don't actually have a next meeting scheduled right now. I'm going to be gone until the 8th, but that doesn't mean there couldn't be a meeting before that, and Jen can certainly manage that meeting. But Andrea will set those up. We'll try to do another doodle poll to be able to figure that out.
Yeah, if Shaun, if you and Jen can send me the times you are available so I can put our 3 schedules together.
Yep.
And then we can set a regular meeting schedule for these.
Yep.
That'll be the basis I'll go on.
Okay. All right. So I want to run down where we're at with the projects. I've done quite a bit of work actually on the tax exemption, which I don't think I need a whole lot of help other than when I develop the bills to get it for you folks to look at on the New Hampshire side. And then how that works on the Vermont side, again, I'm not sure. But I could certainly provide that. I'm using Colorado's and Oregon's, Ohio's statutes as a model to take a look at. So, Brenda, I just missed can you just verbalize your chat?
Yeah, so part of the value I think of hearing from, I just said part of the value of hearing from folks over here is learning about false starts and lessons learned. There are things like, I say we, yes, I work for Let's Grow Kids, but I've also been like an early childhood educator here, a director here. So it's the collective we. When I say we, I'm not just talking about Let's Grow Kids. I'm talking about all of our partners in those past 20 years, including the Child Development Division, the whole Agency of Human Services, like all the people. And we've learned a lot because, we have taken some sort of, we've gone out in the weeds a little bit, and then we're like, whoa, got to come back and refocus. And what are we, so it's the collective we, and it's shared wisdom.
Brenda, I got to assure you are very much welcome, because in many ways, Vermont's ahead of us. So you've already tread this ground, so you can help us in our journey to get there. So believe me, it's much appreciated.
Thank you for that. I really value that this is happening. And, I sometimes feel like, oh my gosh, am I the right person? Because I don't have all the information. I don't have all the answers. The cool thing about having been over here doing this for a couple of decades with all the people, all the partners, is that if I don't know, I probably know who does. And that's also, I think, really to our benefit.
Absolutely. So the tax exemption one, my next steps are to actually draft up some legislation on that, and I'll use legal staff to get that. So I don't think I need anything else from this group for that item. I'm just going to start working on that and get a draft to you folks to look at, and I'm not sure how quickly they can turn that around. For New Hampshire, I can't get it till the next legislative session, which would be in the fall anyway, and the timeline is in the work plan that I provided to you. And Again, I'm not familiar with Vermont state law, so I don't know how that drafting of that language will fit. And the attorneys we use are only licensed in New Hampshire. They're not licensed in the state of Vermont. They're members of the bar in the state of Vermont. So any other comments on that one? Anybody feel differently about the approach I'm going to use on that particular item? I will tell you the other states, Oregon and not Oregon, but Ohio and Colorado, they seem to focus on entities that are nonprofit only, not the for-profit entities. And I think it needs to be both for us, and that's going to be controversial, but that's how things are. They're always controversial to some degree or another. So my approach is going to draft it for-profit and nonprofit childcare facilities. To me, there's enough momentum. This is a big enough of an issue, and the criticality of this issue, it requires both. We've got to try to save this industry and prop it up, and that's the approach I'm going to be using for that one. But there will be issues with that, no doubt, because that'll be the first opportunity under RSA 72. It'll be the only entity that is provided a tax exemption for a for-profit entity. All right. The subcommittee creation.
I can drop in one. Sorry, I can drop in one detail about that. Brenda's phrasing in the chat. She just said that in Vermont we call that the mixed delivery system. And Sarah Kobolinsky and Amy Brooks and I met with Senator Whitley, who has put a couple of bills into play regarding early childhood and child care. And one of the things that she talked about was the importance of having a mixed delivery system in New Hampshire. I think there's another bill that someone else has put in. She couldn't remember the number of it, that had to do with pre-K. And she's been talking with her colleague about the importance of having a mixed delivery system and not tanking one whole piece of it. So I just wanted to say that we have somebody on the advocacy side of things and the legislative side of things who is a total ally, gets it, understands it. So.
And a big piece of the value of advocacy we've learned for having mixed delivery is that then you have all the voices from the industry at the table. Because if you exclude any part, they say, well, why should I advocate for something that's not advocating for supporting me? So it really says everyone is welcome to this conversation, and we actually need to hear your stories and your lived experiences.
The other part of that, even if all of the nonprofit and for-profit childcare operations could operate at 100% capacity, would still not meet the demand. That's the biggest argument that we make when we go to the legislature. Even in the best case scenario, we still don't have enough to meet the demand. I think that's the more compelling. That's the compelling argument. But you're right. We need all of the facets of childcare to work together to pass pieces of legislation, which is always a challenge, I'm sure, in any state house in the country. So the next one is subcommittee creation of a service support cooperative for child care entities. Now this, Brendan provided me with 2 different counties in Vermont that are already doing something similar to what CELA appears to do in our state. So that model seems to be up and running. And there, of course, there seems to be, we've heard concern about the effectiveness of how CELA may work, but it's certainly an effort that at least is effective in some places. So I don't know how much more. I'm kind of put that one on hold for a second, unless anybody wants to comment on that and talk about the next one. Jackie?
I think the only thing I'd mention, Shaun, is rollouts have been ineffective and support has been ineffective. I think CELA is effective. In other words, like when Jenn experienced it, we didn't have the staffing capacity to really help her navigate the fact that it was confusing and too expensive, right? And so, so it's not that CELA doesn't work, it's the rollouts that were done before were not done properly. You learn lessons, right? It's all brand new, it's all innovative, but we're really learning now how people can use CELA and afford CELA. So at some point we'd like to go through that, but I think saying CELA is ineffective is actually understandable without knowing what CELA is, but it is effective.
Right, because we know this model works. It works in other communities and it works effectively. In fact, municipalities do that. It has a similar model. And we also know that CCA Global Partners has a similar model. So we know the model can work. It's working out the details of that and the delivery of that and those pieces.
Also, just keeping in mind with that we are a by state community, and so that having the resources that we could access on both sides, like I have programs in Vermont and New Hampshire. So if I'm coming as a business owner to participate in purchasing, fuel or HR services or whatever, we just need to make sure that it works for our region. So I think that SELA does have its benefits, but it also in our region, might have its limitations. So taking a deeper dive into that, I think is going to be important, and looking at the resources that we have access to in the Upper Valley specifically.
Okay. So we will spend some time on that because we've got more work to do on that. And when I take models that are used by others and I put them in the city, I call it Lebanizing them, and we'll have to Upper Valleyize them to make them work for our needs here. The creation of a consumers cooperative to purchase childcare services from providers. Jackie, do you know anybody else, or Julia, anybody else that's using a similar model? Because I haven't seen one, if there is, that we could take a look at.
And I apologize, Shaun, I need a little more explanation to answer that properly, unless Julie can already knows. Okay.
So what that would be is several businesses would get together and form a cooperative and buy childcare. So we would go to a provider and say, look, we're going to provide, if you meet our requirements, we will buy childcare slots from you. And we will pay, and my argument was, we will pay a higher amount than the present market rate. And we insist that you're going to pay your employees at a higher rate, provide certain degrees of benefit and a certain degree of education in your system. Certain
Beautiful.
And then we will subsidize that either in one of several different ways, right? Our employees are not going to pay more than 12%, for instance, of their income, and we will subsidize the rest to a certain amount per child, and it depends on the level of care if it's an infant compared to a preschool age. So
okay,
I got it. That needs a lot of numbers. That's a number-driven activity, right? We got to figure out what is that cost per child that it should be, not what it is in the marketplace, but what should it be, right? Exactly. And then what is the impact of that? So someone needs to crunch those numbers, right?
Yeah.
And then
it's been done, Shaun. So that's the good news. We don't have to reinvent the wheel. There's something called cost. What's it called?
Cost calculator.
There is a cost calculator. Like if you paid your teachers well enough, and again, not on the backs of the parents. So I do not know, and I'm going to ask Julie right now. That's part of the discussion that's been at those three, 1, 2, bing sprint meetings, just to try to lock down and reserve some gopher dollars. But we have two big things. One is, yes, exactly what you said. It shouldn't just be offsetting the cost for the employee, which is a good thing, right? Because employees can't afford it. But also the provider gets more income, therefore they have more revenue to then pass along to their staff. We have not seen a model that we know of here in New Hampshire that works. We are looking into other states, haven't found a perfect one yet that also takes into good account equity. So in other words, it's not just the executives in certain places that have good access. It's also every family who needs it. So that's, I think, our task, to do both in Upper Valley and statewide together.
Yeah, I'm just curious about the numbers, and you folks obviously know better than I do, but do we have a really good handle though on what that cost per child is though in the Upper Valley? Because each operation is a little bit different, and I just wonder how solid we are on that number. The validity of that number. Is that a good number? Is it a good number in 2022 that we have? So I don't, somebody tell me that.
I'm hoping Amy can speak to that in the work that she's done, because I don't know those numbers specifically for the Upper Valley.
Well, we talked about that, and that's one of the issues, the ability of these small businesses to adequately account for their cost. We're not sure. And not only that, if they're paying, I don't know if they're paying $12 an hour, they need to be paying 15 or 17 or some other higher number. Has anybody calculated that out as to what it should be for different levels of service? And I'm not sure if we have that number yet. And I think we need to crunch that number for this Upper Valley region. And it's different if you're in Hanover and Lebanon than if you're in some of the Vermont communities around us and some of the other New Hampshire communities. So
Yeah.
we've got to figure out what that range is for here. And I think I need someone to crunch those numbers, and that's going to be quite a bit of work to be able to
Yeah.
figure that out.
But it's
I know on
important.
average.
work. It's
It
important.
is.
work. Amy, are you there? I don't know if your internet, if you can speak, or there you are. She's just put it in the chat.
Kim Florida did a study. Oh, just
In October.
yeah.
So it was an actual cost modeling study, Amy. In other words, like if you paid your staff well, this is what you should get in revenue.
I'll just do voice. She didn't do a cost modeling. We understood we understand more about the current rates of tuition, the current benefits and the wages, and Kim did it by budget size and not capacity.
Okay, because Shaun, Michael Kalinowski, a professor at UNH, was contracted, 4, 5, 6 years ago. Of course, the data is old, but his lessons learned were huge about doing cost modeling, both for a region and statewide. And I think before a consultant is hired, we really should bring him in and find out all he learned about some of the pitfalls of trying to get accurate data on it. But I'm sure he would come in and speak to this group about it.
Well, that's one of the things that I've asked from Vital Communities to see if we can get support from Dartmouth. Hopefully no cost support that can run some of the economic numbers and figure out what that really is. Because again, what is a livable salary in the Upper Valley? It's not $15 an hour, I can tell you that. And, we're paying our people in the 20s, even, truck drivers and people that are even low wage and low skill jobs. And even at that rate, they can't afford to live in this city. They have to live someplace else and commute in. So what is that number, right? So that we can adequately compete and get the right workforce to do this critical work that we have. So someone needs to dig into that a little bit more. And I don't have a consultant for that yet. Again, I was looking for someone from academia who might be able to do that from hopefully Dartmouth. I know that Sarah is trying to get that done. So that's, I think, needs to happen there. And then there's also, again, as I talked about before, there's a need for a CPA to take a look at that. If a business is going to be providing that support, direct funding to a provider, whether it be in New Hampshire or Vermont, because again, my employees work in both states and they're going to have childcare in both states. What are the impacts on state, the income tax in Vermont, as well as the federal, and can we get a tax credit for that for businesses? Can we advocate for that and get our legislative delegation to do that? Because that would be a good incentive for businesses. If you provide $10,000 for childcare for one of your employees, can we get that a tax write-off for that in essence? And what's the mechanism? What does that look like? That would be an incentive to do that. But you also talked about the issue of equity, and I mentioned this the last time. This does not solve the problem for those who are working at Walmart, those who are working at Target, and those who are working at Dunkin' Donuts. Those companies are not likely to be able to provide that support. And those are probably the folks who are going to be in that situation that need it the most. The only way to deal with that is government subsidy. And that's a far trickier issue, especially in the state of New Hampshire, maybe less so in the state of Vermont, but there's no endless pots of money, and getting that money repurposed and used for the things that we think are important is going to be a challenge. And it's going to require a strategy that's more on the advocacy side than it is on our nuts and bolts of facilities. But that's the only way that I can think of to do that. I know that the Coos County folks were looking at a child care fund that will rely upon donations and support from businesses, but I'm not sure how sustainable that's going to be. If businesses are going to want to contribute money, most of them are going to want to contribute money for the benefit of their employees. They get a direct support for that, which makes sense. So that leaves government subsidy for that. And that's going to be difficult to get. No question about it. So with this particular option, I need someone to crunch those numbers. I got to know what those baseline numbers look at. So I can turn around to a business and say, okay, if you've got an employee that has a 3 to 4 year old and they have an infant, this is what it's going to cost for each level of service for those children. And let's say they have a 7-year-old as well. This is what it's going to cost for those levels of service to provide that in this, in the environment that we're in, so that we can pay these people a decent salary. And then you take the employees' combined household income, if it's 12%, whatever number we use, that equals this amount. And then this is how much would have to be subsidized by the business. And then can you do that? I've got 38 employees with children. Most of my workforce is older out of 189 full-time employees. 38 that have children. That's really not that many. And what is that going to cost me as a city to provide that particular level of service? And I have to be able to know what that number is so I can calculate that out. So that until we can get those numbers and I can get the people on board who can crunch those numbers, it's hard to make policy decisions on what we can do from there.
Shaun, I'd love to just share a little bit more of my thinking around how you could use Kim Boda's budget planning documents and tools. She may have done, I don't know how much work she's done with Upper Valley programs, but she creates this incredible workbook where you could go in and plug in all of your desired wages for the workforce and then see what the gap is in the workbook. And then if you went in and closed the gap by plugging in what the fees would have to be, then you can see the difference between what's being charged now, what would it need to cost in order to fund the kind of wages that you want. So I think those numbers could be estimated using her tool pretty easily.
Well, that's good. I didn't know that tool existed. But the fundamental issues is what do we have to pay for that entry-level employee or advanced level employees that have several years job experience? What do we pay that teacher in that classroom? I don't know what that number is.
I wonder if we take it and ask Kim to kind of do some work on this too, if she's still got the time, because she has those numbers, but we have to take in that survey that she just did with all of the centers, because it provides variety. Like, you know, my rates and my salaries being in my region are going to be different than, you know, maybe the Seacoast region or the Claremont area region or Hanover, you know. So I think, you know, she's got some tools and I use those tools, but it's specific to my program. Mm-hmm. And so each of our programs are different, and it's different based on our clientele area as well. So I wonder if she could just maybe do a model of a general gap, because I don't think we have the information that Shaun's talking about to do a specific gap. It's more individualized the way she uses her tools. And we're trying to get more, you know, Upper Valley region wise, what that looks like.
Yeah, we do what's called a wage classification study. That's what we do to make sure that our rates are marketable and that we can attract employees. So what, again, it comes down to that question: what is the appropriate rate? And we're not dealing with it. We have to do better than what the market is doing here. So what is that appropriate rate that we pay an entry-level childcare worker? What is that hourly dollar amount, and what benefits package goes along with that? And then the person who's got 5 years experience or 10 years or even 15 years experience, what should we be paying those people? And you may not have a whole lot of that because we haven't built that workforce, right? But we have to start and build this workforce now. And how are we going to do that? To have enough people that are trained and experienced, and they can train the new people coming in. If right now you've got holes in your organizations, you don't have enough staff. So how do we figure out what that number is, what short of a wage classification study? And Brenda, you want to add?
Yeah, so and that's really a moving target right now for a lot of reasons. So there's the National Association for the Education of Young Children started an initiative probably 10 years ago now to advance our work as a profession. So it's called Advancing as a Profession. Power to the Profession goes by a couple of different names, but it's really getting at what do we call ourselves? What should our qualifications be? Who are we accountable to? And then how are we compensated? It has, you know, there are lots of details under each of those. And in Vermont, we've been engaged in this for 5+ years now. And right now, the committee, the task force in Vermont is working on this very thing. Like, what should our wage scale, our salary scale look like? Because now we know what the education pieces are. So the higher ed collab is working on, okay, so how do we prepare our Vermont educators to work here in Vermont and have the credentials that they need? And how do we bring along, where's the bridge to the folks who already have 30 years of experience and want to stay in the field, et cetera? or maybe have come through different avenues, because many of us, we have everything from CDA to master's and PhD.
Right.
And so anyway, they're working on this very thing, a salary structure and how we weigh all the pieces. I will check in with them, and I serve, full disclosure, I serve as a board member for the Vermont Association for the Education of Young Children. I'm not on that task force, but I'm going to check in with them and I'll see where they are on that.
Yeah, because
I thought that they were setting, the last thing I saw from Advancing the Profession was that it was they were using the public education system as context. And I appreciate that thought, and I also have concerns about that because frankly, public educators are underpaid as well and have been for a long time. So
that's one consideration, but it's recognized exactly as you said as a very flawed place to start. And so they have other I can't with full knowledge of what exactly they're considering, but they recognize, like you just said, that is not a perfect template.
So Lucia, I just added into the chat here that if we use public kindergarten data, that could be helpful. At the very least, right now, you're at least competing with the public schools in terms of staff. So that's at least one benchmark for competition that you have. Certainly, the qualifications for early childhood education, again, that's the issue Brenda was talking about. What are they, right? What is that standard? You have to have an associate's degree or no degree at all, a certificate. What are the requirements to be able to meet those minimum thresholds? And if you're a director of a center or in a supervisory position, what are those requirements?
Yeah. And those are now established. So, but that's just one piece of informing how then to be compensated.
Right. And again, it depends upon where you live and what market that you're in. It may be $17 or $20 an hour is good someplace, but it may not be here, because here salaries are much higher. And I'm sure obviously you've got that in Vermont too, whether it be Brattleboro, up in Burlington, the market rates are going to be different, and we still have to be able to compete with that. And of course, that will allow us hopefully to attract people to this industry and this business. So we can get more workers in there, because no matter what we do, we can spend money on bricks and mortar, this and that, but if we don't have the workers to be able to do the work, we're not going to get there. Any other thoughts on this option? Again, I can't find anybody else who has a similar consumer cooperative. And again, this consumer cooperative has its drawbacks. It does not deal with the equity issue, which is huge. But at least we need to start developing some of these bedrock numbers, so we get at least data to be able to move this model forward and build it out. But there's a big hole in it, folks, and I'll keep repeating that. I had discussions with, I'll call it upper level management in our state, at the state level, and they're not really interested in hearing how we're going to solve that problem with the government perspective and how we're going to subsidize those that can't afford it. They're more interested in helping businesses. That will help out a number of people. That was the argument that was made. That will address a large portion of the issue, but it does not address all of the issue, and the ones that we're probably most concerned about, because younger employees tend to be the ones who are less paid in the first place. And I've got a whole service industry in this city, and of course every other city has the same thing. What about those folks? Those are the folks, if you look at the national determinants of health, are more likely to have substance abuse issues, and you folks have seen and heard all that before. We know that. Other folks don't want to hear that. That's a different problem to deal with. And I was told, get a package together to do the most you can, help out the most amount of people that you possibly can. But those most amount of people tend to be the ones that are in the middle income range or the upper range. They're not the folks at the lower range. And I've got an entire city to take care of.
I just wonder if it would be, just throwing this out there, what about some sort of funding that all New Hampshire businesses had to contribute to as a tax write-off, or could contribute to, that was sort of managed by, the New Hampshire subsidy department or something like that, where, so the families don't qualify for subsidy, but they could apply for this other fund to supplement or offset their financial burdens for childcare. So like you said, you would want to contribute to help your employees specifically, which this wouldn't necessarily do, but everybody can contribute with some sort of tax reduction or something like that. And it sounds like it would be a lot more to manage that. So I don't know the implications. I'm just kind of throwing out how to make it a little bit more equitable and accessible for all families in all communities.
If New Hampshire had a broad-based tax, then I suppose that would be of some value, right? If we had a state income tax or something of that nature, we could say that, that you could do that, but we don't have that. Our broad-based tax is the property tax. And that would be very unpopular, I would think. And again, businesses are going to want to do things that are going to help their bottom line, help their particular employees. That's going to be their focus. Because otherwise, what we're talking about is a tax to be able to deal with a public problem. And that's a different animal, unfortunately, to deal with.
I keep thinking about Shaun, you asked me for my brain, so I'm trying to use it to everyone's advantage, not just take notes. First of all, I keep thinking about that really important thing that Rebecca Holcomb said at the symposium, which was really being thoughtful about the implications of the choices that you're making. Like, we didn't realize what was going to happen when X, Y, and Z. But when you see X, Y, and Z on the slide, you're like, well, of course that's what happened. Of course it's what happened, right? So I'm thinking of that in terms of what happens like when we have inequitable, like we increase this access to childcare in an inequitable way, right? I'm sure that's been replicated other places. We could probably get data on it and say, here's what happened in the communities. The other thing I keep thinking about is how, and this may be something that's more for the advocacy group. I don't know. This is where there's a little bit of, blending and stuff between the work groups, but how we provide information to businesses and to legislators about the cost, and there is a financial cost if you want to monetize it, to not taking care of people. There is a cost to harming people through lack of access to childcare. Right, everybody's nodding. Mm-hmm. I'm sure that information is out there, especially in COVID. I know lots of people had done research on that in terms of like the social cost of that. So if I'm curious about whether we can pull that information from somewhere and pair that with whatever we write up to present to legislators. Like Jackie, I'm thinking of your group too. Like, I'm with Brenda. The us is as inclusive as possible when I say we, because you can't argue with that. I mean, you can continue to. I understand how capitalism works, and also, like, we need to take care of each other, or there's a cost to everybody. It is eventually going to end up in your backyard. So I'm like, these are things I keep thinking as I'm hearing everybody speak about this.
I mean, one of the ways that people frame that, not just here, is about, so it's sort of the flip of what you're saying, which is, what is the return on the investment? And that's, it's mental, it's physical, it's social, like down the road. It's not just today, but it's like down the road. And I think we talked about that here before. The Hechinger report, says it's 15%, and another report says it's, I don't know, some other, number. And in Vermont, we say it's probably closer to 5 for us, somewhere between 5 and 8, depending on what you're measuring. I'm one of those people who likes to frame it in like, what are we getting here? Like, what's the positive flip of it? And yes, it's the same thing. It's just saying, the reason we want to invest is because it's really worth it in every respect. It's Heckman. It's the Heckman equation, right? So I said Hechinger report. Sorry, H anyway. And right, that's 13%. So thanks, Amy, for popping that in.
I'm thinking too of some people respond more to carrots and some people respond more to sticks. And when we're in a crisis moment, sometimes the stick is more compelling. But I think all of that information is important. And I think like having a way to pair that, put that together with like any kind of proposal, any kind of suggestion, this is the why.
So 2 weeks ago, I had this discussion with a high-level political official in our state. They said, so what are you proposing? Are you proposing that we use the public school system, provide childcare now, and have the government operate it that way? I said, no, I don't think that's the, if you're looking at the 80,000 foot level, I don't think that's the answer. I said, we already have a sector that does this. We have nonprofits and we have for-profits. That they need subsidization to make that happen. They need support. We need to help build that industry. We need to be able to support that industry. But no, what you have is you have a service that costs this much, and we're providing this much, and the people that have to pay for it don't have the ability to do that. So it's not a business model that works, right? So the only way that works is it requires subsidization from the government to some degree. It's support. There are some things that are not, they don't produce a whole lot of profit. It doesn't work that way. Public education is one of those. Police and fire protection, that there's no money to be made off of that, right? It requires government subsidization for that value, that public value to do that. So I would rather use, and they like this better, I'd rather use the private sector and the nonprofit sector to be able to provide this service with the government supporting it. And 2 weeks prior to that, I had a discussion with another mayor from another city about this. What are you doing this? This is an issue in our city now. And what's your guidance on this? And I provided that to them. I said, you can sit around and do nothing if you choose to, but your community is going to suffer from that. And that's why I'm involved in this, because this is a public issue that we all have to address. So enough of that soapbox discussion on my behalf. So I hear what you're saying, but I'm also working in a political world that I think you all can appreciate. So we've got to get as much as we can out of that. And we cannot forget about the little people, because there is an equity issue here. This model that I'm talking about isn't going to solve that. It will solve some of the problem, but it will not solve all the problem, and it will not deal with the people who probably need it the most.
So Shaun, one of the ways that we've been able to harness those employers who are saying we need a solution, and we want a solution, and when we want to be part of it, is we've said testify to the legislator. And there are a bunch of stories on the Let's Grow Kids website that where people share, like where business owners share their testimony. But literally, I feel like for the last 3 years, we've been lining people up like weekly when we're in session to say, here's how it impacts my business. Here's how that impacts Vermont's economy. Here's how that impacts, people's spending capacity in my town and, whatever. So we're connecting the dots for them.
Yes.
And not because we're saying our policy wonks are telling us this is data, but they need to hear it from the families, educators, program owners and operators, the business owners, like all the people. And so we have developed this network of people, and literally people jump on every day. Like we'll get these internal communications that like, hey, I think yesterday it was the people who make that beeswax, can't remember what it's called. Like I want to say bees knees, and it's not bees knees. Anyway, they became, they're like, we want to testify because we've got issues here, and it's so important to us, and we want our legislators to know. Some of them have developed personal relationships with their legislators. So like cultivate their voice, invite them to say this, not just you, this is a problem, but to their legislator, this is a problem. You need to figure out how to solve it, and we're here to help put our heads together.
So Brenda, you said earlier you're involved in a marathon. Well, so are we. We're trying to make a sprint because we need to make a sprint. There are things we need to do right away, but we're also in a marathon as well. And bringing people along that journey, that you can't stick your head in the sand forever on this. You're going to have to take a stand somewhere, and you're going to have to do something. And we're going to help you get there. And you may not always want to hear from us, but you're going to hear from us. And we're going to come up with plans, and we are going, our allies are getting bigger every day. So to your point, Brenda. So at the end of the day, we will achieve some degree of success. What that is, I'm not exactly sure at the end of the day, but we need to have something that we can present to them. Here is the plan. This is how this could work. Here are the pieces of that. And that's what our task is, I think, here, is to get them along that way and give them some options. Because they can't sit there and bury their head in the sand forever on this one. So anyway, any more on this particular issue while we're waiting for data? I think Kim Voda's her spreadsheet is going to be helpful to us. But I've got to have someone who can figure out what that appropriate salary should be, what those should be, and what the appropriate benefits package should be to attract people into this field. We've got to do some work on that, and I need a CPA that can deal with the issue of how the direct support a business would provide. How is that to be dealt with, and what are the tax advantages for that? And what bills need to be changed to allow that to occur? So I've got to work on those pieces. Any other thoughts on? Yeah, Julie.
Shaun, I would just add to that point that I think there could be a parallel strategy to look at the tools that Kim Vada has developed. How can we apply that for the Upper Valley, but also to look at the national cost modeling tool, which would require us to do some work about getting to some common assumptions in order for that model to be effectively used. So there may be a couple of pieces that we could look at, and getting some assistance from folks at Dartmouth could be excellent if that could happen.
Yeah, because Amy provided me, or actually, I think it was Brooke Furlan provided me that information, that calculator in there. I just didn't find it particularly helpful because the inputs that you need here, I don't know what all those numbers are, right? Someone has to figure that out to make that work. And if we're figuring it out today, by the time we get it in place, we need 2023 and 24 to be able to line that up and build that. I just know from my perspective, when I do a wage classification, when I hire someone to do it, because I contract out to do it, there's a whole lot of pieces to that. There's a lot of work that goes in that. And a lot of that baseline data is more readily available than it is in this case, because we're creating an industry. Well, the industry already exists, but we're creating jobs and salaries that don't presently exist, what that number is, what it should be, right? So it's a bit more tricky.
It is.
Shaun, would the work that Brenda was talking about that's underway for Vermont be helpful as a starting point?
I definitely think so. And again, Amy could jump in more about this, but in terms of the qualifications for those jobs, positions, what they should be, I think that's very helpful. You've got to build that part. That's part of a wage classification study. What are the skills? What's the educational level that needs to have for that position? If you're going to be a supervisor, how many years of experience should you have before you take on that role? Those sorts of things. What does that mean to this profession to be able to call itself a profession? What are the requirements to do that? And if they've already started that work, that would be definitely helpful to us.
And is there something comparable on the New Hampshire side that we could pull from? Yeah.
Yeah, you hadn't jumped on yet, Sarah. And I was mentioning that a couple of years back, I don't remember how many years back, Michael Kalinowski was contracted to do regional cost modeling for childcare, cost of care, as well as statewide. And so he had a lot of lessons learned from that research. I have no doubt that he would help us know what that is and some of the pitfalls to avoid in doing this good research. Yeah.
Jackie, can you provide that to us if you've got that study, or at least the contact information from him? At least
I believe they ended up not publishing it because there were so many lessons learned about bad research techniques. But the point is, that's the point, right? Is that he should tell us what he learned and why they didn't publish it. So I know he'd come and talk with you guys. I have no doubt.
So you think you can provide contact information for him?
Yeah, I did earlier in the chat, but I'll make sure Andra has it. Yeah.
Yeah, it's difficult for me when I'm running the meeting to look at the chat too.
Yeah.
I forgot that. That's right.
I'm doing my best to get it into the notes and everything, and I save the chats, so I'll incorporate that into the
I'll
notes.
contact him, Jackie, because he kind of owes us for his family study.
Fabulous, and he's marvelous. He's really well respected in the state, Shaun.
I'm gonna I want to loop him back in, like tightly connected. So I'll contact him, Shaun.
Great, thank you.
And then Jackie, or sorry, Brenda, you'll follow up on the Vermont study.
Yes.
Okay.
Yeah, we already so we've already done some of the work. And so I'm looking the reason I went off camera is because I'm trying to find if there's like a sort of a link that I can drop in here so that you can access what's already done. If I can't do that, I'll send it out after.
Great.
Okay, anything more on this particular item? Because we have a couple of others to make sure that we at least get the talking points and get some movement on. All right, on the zoning one, I'm gonna be assigning that to my planning department to see what density bonuses. We talked about this before, and create a template that other cities and towns can possibly use in regards to zoning for childcare facilities. It was an example we heard from in Jackie's session there from Manchester. The difference between 5 and 6. The state allows up to 6 kids for a licensed facility, and Manchester only allows 5, and they're going to be working to make that change. I've got to look at ours and see if we have a similar situation. But if we can create a model zoning policy that other municipalities can use, that will be really helpful. And that can go out to the state, at least in New Hampshire, of the OSI group, the Office of Strategic Initiatives. And I don't know if there's a similar office. You must have a similar office in Vermont that does that we can send that out and be able to use. That could be helpful to our childcare businesses. And then this also came up with the PowerPoint presentation from the Coos County folks about using, if a housing development's going to occur, or an industrial development that might occur, leaving room for childcare facilities. And that kind of falls into the public-private partnership that we talked about briefly. That has some value. Again, I just built an industrial park. I only have one of the plots that's been leased out, but I have others that I could allow that to be used by childcare provider. You want to build a facility, we won't charge you anything. You will be given that land and no charge for water and sewer hookup, run a facility there, and you've got to provide half of those slots have to be for low income or subsidized parents. That's the value of being able to do that. That's one of the ways, that's the way I'm using to meet that need. I'm doing a similar issue with housing here in the city, using city-owned land. Well, you've got to provide a certain amount of low income apartments. Over at the DPW, the old DPW, we're putting in 95 units. We're working with a developer. 45 of those have to be for workforce housing. They have to meet those requirements for workforce housing for the next 25 years. So that's one thing that I could do here by using city-owned land. We'd have to find an off-taker, someone who would provide that childcare facility there at that location. And I don't know how I'd go about doing that right now. I know how to do that with other businesses and other industry, but I don't know how to do that with childcare. I mean, how do I go about and say, listen, we want a request for proposals from a childcare provider to run here? Well, most of these childcare providers are small companies. They don't have time to put that together, or they probably don't know how to put that together. So how do I do that? Do I build that facility for them? I'm going to build you the bricks and mortar. Here's the building that it's going to be in. I need you to run your programs out of there. Like I did in Allenstown with the Boys and Girls Club. You run your programs, I won't charge you anything, and I'll keep the lights on.
Shaun, it is true that, that often, what's good is that you wouldn't just get some brand new vendor coming from some other place, but, you could do a really supportive RFP process. So in other words, so that it's not just the big ones who automatically get everything, right? Again, if there's this idea of a cooperative and a coalition, then, it could be somehow, again, down the road could be jointly managed in some way so that a lot of different programs come in together to run. I mean, in other states, Shaun, sometimes they don't open a whole new center, they open some classrooms, right? And, because there's only a classroom needed over here. But again, it's run and managed. It's a shared service, another part of the shared services model. There's my dog, sorry. But anyway.
Yeah, and that's one way to deal with the equity issues, is using public assets to be able to provide for that. So that's a lot more complex and requires quite a bit of thought in how I would manage that. I mean, I did have the model over in Allenstown that I used before, but this is a little bit different. I'd have to think about that.
Amy, is that something you would sort of have your finger on the pulse for in terms of, I mean, I know that the first issue is getting staff to be in such a classroom or group of classrooms, but would you know, or Jenn, would you know of centers that might be needing that kind of space? Because it seems like a great opportunity.
Well, definitely lots of programs would probably be happy to satellite or have multiple, because then we get to share expenses for many other business entity or expenses. But like you said, it's the staffing piece, right? Like, I know that we could definitely add on and expand out. There's not a lot of options down in the Grantham, Newport, Sunapee area for childcare, but nobody that I can think of right now is going to even consider that with the current staffing crisis that we have. So yes, it's something that could work in the future. And there would be people that would jump on that, but currently, I don't foresee anybody doing that.
So the way I look at this takes a while to build this stuff. It took me several years to do this in Allenstown. So this is something I can work on. And then hopefully within a few years, we don't have the staffing problem that we have right now. But that certainly is an issue there. And then if I build this facility and we steal people from other childcare operators, that doesn't do us any good at the end of the day. But it is one way to tackle the equity piece, is using public assets to basically subsidize that in a different way without direct contributions in cash. It's running the building and building it. And I have to figure out how that model works. And if I did that, if I said, look, I'm going to build this building for you, you're going to operate your program, whether it's a for-profit or a nonprofit, what would that rate be that you would have to get to be able to cover your operating expenses, the staff, in essence? What would that be to do that at that higher rate that we're talking about? And what does that
I
look
think that that's where, like, as a business owner or a board, they would have to go through that for no matter what. If they wanted to put in a bid for running that program, like that, like most businesses do, they have to provide you with a bid to get the job, right? So I see that being the same thing. When I applied to take over the after school program in the Hartford School District, I had to provide documentation, or I would say a bid of what were my costs going to be? What was I going to pay my staff? What was it going to charge to the families? So that they had all of that information ahead of time. Not plus, what's my philosophy? Right? Does that mesh with what the city is looking to do? So to make sure it's a good fit. So then you just kind of put it out there, and then we have to do our part to submit that information.
Yeah, but the difference is that we as a city don't want them paying somebody $12 an hour. We want them to pay them a much higher rate. So that comes back to the other discussion of what should be the appropriate rate to do that, because we now look at things through an equity lens, and how we're going to do that. So,
and maybe those are parameters around what you set forth in what you're looking for, and then we have to decide, can we meet those parameters?
Right, and that's what I'm saying. That's why knowing what those numbers are is very important. We come back to that bedrock issue. But this takes several years to put this into play and make this happen. The community development block grants and the tax credits I've used before, and I already own the land, so that's not an issue. How I make that happen.
But I would just say, for somebody who's built a childcare center from the ground up and been a part of that, if that's your intent, it would be good to have somebody with childcare knowledge on your design team. So because we know what works and what doesn't.
Oh yeah, I don't do that part of it. I'm the one that has to go find the money and get. Yeah, I don't know how to do that. I fully admit that that's not my area of expertise. I did the same thing at the Boys and Girls Club and the Senior Center. They designed all the pieces in there, and I built the building for them, but I didn't try to figure that out. They're the experts on that. But that's going to require a team of people to do that.
Shaun, do you mind if I ask a question? I'm curious, and maybe Jenn and Amy can best answer this. Is it possibly because there are so many committees that we don't see that many childcare providers on these calls, or they just don't have time, or we don't have a set schedule? I was sort of wondering, thank you for being here on their behalf, but do you know why are there no other childcare providers on this call, do you think?
I think this one is a little bit more foreign for those of us in the field, me included. So I'm doing my best to follow Shaun's lead. And then I think timing. is definitely an issue. Like even I have a hard time committing to all of this, and the added emails coming in, I'm not as I feel like I'm not as responsive as I need to be. So I do believe there's a time commitment, and there's just not that capacity.
Thank you.
I think our thinking on this, Jackie, or the way that I'm looking at this initiative is that, and again, once we have a system for asynchronous communication and storage of documents, that there ought to be clear ways for anybody at any time to be able to plug in and say, I can throw in some data here, or I can write up a little thing here, or I can attend a meeting, or whatever it is, so that that accessibility issue isn't driving the work, because right now all of the work groups meet during the workday.
Got it.
And even
we could
for folks,
change that,
I mean,
couldn't we change that?
we could change
Maybe.
that. I
Yeah,
mean,
okay.
yeah. So, yeah, we could, I mean, honestly, that's one thing we can look at, Shaun and Jen, is also like one of the meetings, so if we meet twice a month, one of them is during the workday and another one is in the evening. So if you want to send me your availability with that in mind, I don't think that's a bad idea. I mean, frankly, if we have 2 meetings a month and we're getting, two kind of different groups of people at those meetings, like, but the 3 of us are holding the work, I think that's a good model. So.
And I don't think that it's because of lack of interest. I'm absolutely 100% sure it's not because people don't want to be present in these conversations. They literally don't have the capacity. Even if we offer evening meetings, people are busy doing the paperwork that they didn't get to do, their administrative responsibilities that they didn't get to do during the workday because they were in ratio, because they're understaffed. And even then, they have had to put many programs have had to close at least one classroom and or curtail their hours because of the workforce crisis. So like they're all hands on deck in other places, and throw in a pandemic to boot. I mean, like.
Yeah, I just wanted to share that we in New Hampshire here with our Zoom calls have never had such a large turnout of people trying to be involved. Of course, they can't make every meeting, but we used to have in person with 20 to 25 folks who really were. We have 100 to 140 twice a month. We have, and it's not, it's not that they're also, they're busy, but again, we've also had people say, wow, don't do things, and you all know this, you've said it, Brenda, don't do things for me without me. And it's just this accessibility. Can we offer a few more things that might be possible for them to join? That's all. Yeah.
So I'm going to move forward on that, but I've got to give some more thought to the public-private partnership. There's other public-private partnerships we can certainly do too. This isn't the only way to do that. There's different variations of that model. That was just one that I thought about, and fortunately, where the industrial park is now built, they're installing the electric power now, but the water and sewers there, the roads built, and the lots are cleared off. So that part of it is done. And I'm gonna, at least for right now, I want to reserve one of those 2-acre locations for this purpose. And I've got an annual outcomes and strategic plans with the city that's due in April, and I'm going to put that in there. I already have a childcare component, which was never there before. That is now one of our annual outcome statements and part of our strategic plan that presumably the council will approve. I believe they will. But that's going to take time, because I've done this before, and it takes quite a bit of work to get that. So I'm going to keep moving forward on that and at least reserve the space right now. But again, there's other opportunities for public-private partnerships to be used.
And Shaun, that's a huge, significant opportunity. I don't want to gloss over that, because that ability to help defray facility costs is tremendously significant. So thank you for being willing to take that on. That's amazing.
It did work. Again, it worked well for the Boys and Girls Club and the Senior Center, where I used that before. And we also provided the subsidy on top of that to the Boys and Girls Club for their programming that they provided. Because
so I have another question that it made me think of. One of the things that we've been trying to do on this side of the river too is, so if there's not an entity to provide the sort of physical plant, then is there capacity, and who has it to fund, to put money in to a project so that a business is not saddled with debt to begin. And you know, there are, I guess, you know, many ways to go about or approach that. One of the, and this is not a solution, it's sort of a, what do you call it, an immediate help, but we've started telling people, well, not we've started telling people, but I'm working on several projects where they apply for like really big USDA rural development grants. And so I'm wondering, like, do you guys have, is that happening over there too? Because people have been awarded 150,000, 100,000, you know, another place $150,000, which really cuts down on the debt load as they go into these startups. And so that is not a long-term solution, but you know, I'm just thinking about like right now, what can we do? You know, is that possible? Like, do you guys have a rural development office over there? I don't know.
We do. It doesn't apply to the city of Lebanon because we're too big. We're over
Right.
10,000 people. So we're not really that big of a city, but for their purposes, we are. We're considered to be too big. But that doesn't mean the other towns can't do it around us, though. But
And
you-
Brenda, I do think those funds do get tapped, probably not as much as they should, just because it's federal funds and they're tricky to access. But I think Shaun's thinking about how do you package community development block grant funds, CDFA tax credits, and that's a lot of the work that we do at the Community Loan Fund
Yes.
in helping people to put those pieces together. But it occurs to me, Shaun, another tweak we might want to think about is the CDBG rules, because meeting that 50% low income threshold is
I know.
challenging for childcare because the enrollment fluctuates so much.
Yep.
So on any given day, you could meet that threshold or not.
Yeah, that's why if we're going to do some public property, we're going to have to, it's going to have to be dedicated for that, predominantly for that service, that level of service. And if I'm going to be doing it for the city, I have to do that anyway. I'm not going to provide it for, rich folks, obviously. I need to provide for folks who can't afford it, ones that are
Right.
struggling. That's why we use public assets for that. But you're right. I mean, I had to maneuver, it took quite a bit of maneuvering to actually get a community development block grant for a community center, and also the tax credits too. It took a whole lot of aligning. That's what I'm saying. It takes time.
It's a lot of work. It's
It's a complex package. Yeah, you know
Yeah.
firsthand how that is, because those funds are not really supposed to be used for that purpose. So I had to work around to get that to happen. But anyway, any other thoughts about the public-private partnerships? Is again, that's only one variation of this. Other possible variations that could work here. Because I know Jackie talked about just using a classroom someplace, and we don't have any that are open, at least on the school district side. In fact, I got a meeting with them at 1 o'clock about a very similar issue.
Yeah.
They
Yeah,
don't
very
really-
similar. Yeah, sometimes people do use schools. Again, I want to reiterate, you've already got classrooms with furniture
Sure.
and admin. They just are closed because of staffing. Priority number one. Priority number two, yeah, classrooms in other states, because the need may not be for a center in a certain location. And you heard on those calls, Shaun, where Connie Roy Chachowski, for instance, from Northeast Delta Dental said now that they're teleworking, they have extra space that they've never had before. They actually, so between where is the extra space, even believe it or not, National Guard have been used in other places because they're only used on the weekends. So
Right.
the whole idea of just being open to new ideas, what's the best way to serve the community, but taking it all into account and looking at it all holistically, the way, Jenn is talking about and Julie's talking about. You don't just build and then you've got no lack of enrollment over here.
Yeah, I'm just trying to think about, the city has a lot. I mean, the city can obviously borrow money cheaper than anybody can. It's 1.78% interest right now. I'm paying for a 20-year bond, and that's pretty low. Of course, that's going to go up here shortly, but the private sector cannot borrow at those rates. So we have, we can build public facilities and borrow money cheaper than what anybody else can, for the most part. So there's that opportunity, using public lands where they're available and public spaces that are already built. The meeting I've got at 1 o'clock involves the Seminary Hill School. They've got staff, the SAU has staff, and one person in each 700 square foot classroom in there, which they could take 4 or 5 of those people and put them in one classroom and free up 2 or 3 classrooms that could be available for other uses. And a meeting with them at 1 o'clock with an architect to have a discussion about that. Of course, now that they've got territory and they can spread themselves out, they don't want to give it up either. But anyway, that's a different battle. Any other thoughts about other potential opportunities for public-private partnerships that would be of value? All right. And then the last one, we had the business literacy skills support. And I believe there's a share model. I was looking at the notes we had from the last time, where RVCC could help out, New Hampshire Community Loan Fund could help out with that in terms of a share model. Julie, do you want to talk more about that? Because that's in the notes here from last time.
Sure. Well, I think, again, there are many different approaches to kind of the business education piece of this work. Some of that can happen through shared services. The Community Loan Fund had developed a business of childcare initiative, which provides focused technical assistance to childcare programs. And there are times when we've had funding where we've built in, a self-assessment process, technical assistance, and when we can, mini grants. And certainly Amy has used some of that work here in the Upper Valley. Kim Voda started this initiative with us in Coos County and has, brought that knowledge and skill to the Upper Valley. So I think there's certainly a lot more that we could do there. We're actively talking with Early Learning New Hampshire in some collaborative planning about how do we better align that work with the work that Early Learning New Hampshire and SELA are doing. So I think there's lots of potential in this space. But again, recognizing we need to meet providers where they are. They're very limited right now in what they can take on. So how do we rethink that to make these supports available and accessible to folks in the way that it works for them?
Is that one of the projects that you folks are considering to send to Taylor? Yeah. Okay. So the question is, do we need to spend any more time on that in our regional group here on that, that's being at least looked at the state level?
Yeah.
Not that we, so I can't answer that question, but I'm just thinking that whenever we get our shared document space, I'll drop in how people connect in Vermont so that those of us who also are doing work in Vermont know where to point people. And, Julie's partner org is the Vermont Community Loan Fund, and we have other things going on as well. But thank you, Julie. That was really helpful.
I have a question in terms of what are the constraints to expanding that service now? Is it mainly funding so that you can be hiring people to get out and offer these services?
Yes, funding and staff capacity.
Because one thought that comes to mind, a couple of us met with Dartmouth yesterday because they're starting to look at childcare and want to know what they can do. And there was somebody from Tuck there, and Vital Communities has used Tuck students for different initiatives. They have and I think they have something called community consulting. And so I'm just wondering if they were given if there was a sort of a package that they could deliver, almost here's the material, go and work with Center X on what their challenges are. Could we get something up and running?
Yes, possibly, Sarah.
Absolutely.
For you, Julie, but we should look at it. One of the things one of our lessons learned over the years, Sarah, has been someone who's deeply trained and deeply, who gets up every day and understands the benefits is good rather than a constantly evolving group of people. However, we are learning, there are things that can really help both the teachers in the programs as well as the programs themselves. Without that deep training, we are starting to learn that. So Julie, I'm sorry to answer for you. You answer as well, but I think we should talk about it.
Yeah, and I think you're right. There are layers of support that can be offered, touch points versus the programs that may need a deeper dive. Not everybody will need that. So I think you could, think through an array of services and supports. Childcare Aware has a course that they offer. That's a great course on managing a childcare business. But in our experience, it was that TA support that was really needed in a lot of instances. But I think we know programs have different needs. And yes, Brenda, First Children's Finance is, the leader in this, and they have developed excellent tools and resources, again, on the business side of operating childcare.
So I guess the question and this is more a question for Jen and Brenda, when these programs are put into place, how effective are they? In other words, the users who are supposed to be taking advantage of this, what's the value they're getting out of it? Is it of high value? Is it of low value? Is it targeted specifically enough to them to be able to meet their needs? I guess that's the question. Does it actually work? There's a lot of times we put programs into place, we bring people in to provide them, but they don't necessarily meet the mark for the people who really need them. Any thoughts?
I'd love to hear, Jen's feedback. From our perspective, we've not done a longitudinal study, but anecdotally, the people that have participated have indicated in many instances, not in every instance, how participating, certainly in the business of childcare, they've been able to actually improve their business practices that have generated more revenue. And I think if you go broadly, you would need to build in that kind of evaluation component to really assess that.
Jackie?
And I agree, it's also anecdotal evidence, but I want to go back to Jen's point. When she said the last meeting I was at, it was confusing, it was unaffordable, I didn't know what to do, I didn't find it valuable. She was right. Because it's SELA, for instance, we've learned if you don't get the support, it just basically, they don't use it. But if they do use it, if they do have the support, like it's honestly with support, an average size program. And Jen, what is an average size program in Upper Valley? 11 staff, 5 staff? What roughly?
Yeah, I'd say around the 10 mark, 10 to 15 mark is average.
Great. And so again, between liability insurance and I'm not going to go through all the list, but usually with if there's good support, there's roughly $5,000 to $10,000 back in the account that, into that particular program. Each one of their staff honestly have the ability to get about $1,000 at least worth of benefit if used. I'll give you a quick example. Rochester Child Care Center. They've been members since 2011, right? They're still members. They love it. Last night, we were using this new model of trying to help people specifically. We have talked, one staff member besides the admin team ever used SELA in 10 years, Shaun. We went because, again, it had not been a specific, okay, you have this benefit. Did you know about it? Nope. Et cetera, et cetera. We went last night, talked very differently with more people, very specifically, and they all raised their hand. They want to do it. They want to try it. They want to try this. They want to try that. We could at some point give a real deep understanding of what I mean by it, but it was completely different than it's ever been in 10 years by talking with them in a way that they absolutely know what we're talking about. We're not just having a meeting, going away, and nothing happens. We have a whole new way of bringing it to them. Yeah.
Okay.
So Jen, did you have something you wanted to say? Because we asked you and I'm just like, I don't want to jump in ahead of you.
Well, I think I was getting confused whether we were talking about like monetary budget, like supports and systems, or the SELA supports and systems. I think in general, what I would say is we tend to take these trainings and go through these processes and be a part of these cohorts to learn business models and improve business practices. At the end of the day, we get so consumed, and myself, I have to go be in a classroom very soon, but we get so consumed in just making the day-to-day that putting that into practice, right? So I just brought in a new system for my team. Nobody else that I know of in this area is using, and it's about, quality improvement. But the getting started piece like there's a lot of getting started, right? And you have to have that support in order for it to be effective. So the outcome is going to be wonderful, and it's going to hold everybody accountable, and we're going to share that accountability across the program, and take our ownerships. But we have to get started. And right now, with the way things are, I anticipated being that leader, but now I as the owner am in the classroom as well. There's not that time, right? So it just comes back to having that TA, that one-on-one sort of checking in on your program to make it effective, because until we figure out a better way for us to not be in the classroom and actually be able to focus on those things, the reality of improvement is it's just not there.
I just want to reflect back in these, since it's 4 minutes till we have to end, that we will be figuring out what meeting schedule we will be having, and I'll send out options with working links. I'm hearing a lot about the fact that literally not having people to work the jobs is the #1 underlying issue. So we may want to prioritize our work plans, like when we start breaking down action steps and things, and getting specific about when we're going to do what in this work group. We may want to sideline some of the stuff that we've talked about, even though it's all related, it's all important, all of that. I'm really conscious of, like, if we want to gain traction in any of this, I'm just hearing that having the people is the biggest thing. and how can this work group support that in the best way? So just reflecting that back.
We have a work group that's working on retention and recruitment. That's their primary mission. A lot of the tasks we have, they take time, and we've got to start working on those work plans to build those out. They are more, as Brenda indicated, they're more the sprint. I mean, not the sprint, but the marathon. The sprint is dealing with the retention issue. That is the sprint. We have to deal with that, because otherwise we run the risk of the whole system collapsing here, or coming very close to doing that. But most of what we have takes time, and it takes, we've got to build these pieces out. And that's what we have to start working on, the pieces of that. And that's staff support piece we need right now. I'm talking about staff support for building these models. We've got to get that, that data piece worked out. Without that bedrock data information, it's very difficult to build these models out. So we've got to figure that piece out. So as Andrew said, we will send out a survey to see who's available and schedule the next meetings. And then by then, Jackie will have an update for us in terms of the third meeting, and some of you folks will be attending that anyway, and we can get a brief back on that. And we'll also get a brief back from Amy in regards to the retention and recruitment committee to see what they've got in place as we continue to work ours. And I think that's it for now, unless anybody has anything to add in the last 2 minutes that we have.
And
Right.
one quick thing. So in addition to all that Jen just said, and Julia and Jackie as well, using tech solutions. So once people sort of understand, it doesn't, we don't even have to go back that far. Tech solutions are also supportive for people understanding business operations and for supporting their business management. And then it also takes away having to have people on the ground in my town or my region, because it's connected to something national, something bigger. And so they have a built-in community of whoever's doing it in Vermont or New Hampshire, but also whoever's doing it nationally. And so they have people they can go to, they have coaching available, they have PA available, and there's like ProCare and Smart Care and Wonder School and all sorts of, some of them are more savvy. We worked very closely with ProCare and Smart Care and Wonder School to make them really Vermont friendly. And so that's also something that I think, I'm not sure who's holding that, maybe CELA, but I know people have done that in New Hampshire as well to make it New Hampshire friendly. Because we're like, hey, we have some unique issues. We're really rural, and we have, like, here are some of our needs. And so sometimes we don't even have the bandwidth to be in these meetings. So help us find ways to really support what we're doing. And the report back is that it's been transformative.
So that's one that Amy Brooks and I talked about yesterday. That's low-hanging fruit. We think that's an opportunity to get some of these funds to support that. Some sort of long-term agreement, 5-7 years, to pay that up at front. When we've got one-time money to pay that all up at front and have that long-term contract. And the key thing is to provide the direct support. So I'm gonna go into your facility, I'm gonna set this up for you and work through the parents, so that the staff of the childcare center don't have to do that and do all of that piece. That's the other key part of that work. That has to be included in that request for grant funds, the ARPA funds.
So, and we're doing that in Vermont. We have piloted over the last 7 years. We've piloted for all of those programs. We have a new cohort starting next week. We're 10 more Wonder School members. And what we do is we say, we'll give you the first year for free. We'll cover some costs. We'll offset some of the costs for after that. And like, basically we'll give you the coaching, the TA, the money, the stuff. We'll get you set up so that you can see how it works.
Excellent. When we are out of time, it is 10 o'clock and I'm going to jump into another crisis in another room. So I will see you folks at the next meeting, and Andrea will let you know when that's going to be, because she'll send out the survey. Have a good day. Thank you for your time.
Thanks, everybody.
Thank you, everybody.